Picture this. You're going to the doctor's office for your annual checkup and you're feeling a little anxious. What if they find something wrong with you? What if there isn't something wrong with you, but they think there is? You try to brush it off as you're sitting there waiting for someone to come in and check your vitals. Soon enough, the doctor comes in and starts taking your blood pressure, and it's high. What could be wrong? How could this happen? Hi, my name is Alexis, and today I will be presenting to you a paper that covers the importance of accurate blood pressure readings and the use of automated devices to do so. The scenario presented in the beginning of this video is a possible problem that a lot of people face because of what is commonly known as white coat hypertension. Hypertension simply means high blood pressure, and white coat hypertension is a temporary form of high blood pressure due to the anxiety of being around healthcare professionals. It can occur in any person and with any kind of medical checkup. There is no one type of person that can be affected. It could appear in anyone. When trying to diagnose high blood pressure, healthcare professionals need to have the most accurate measurements of a patient's normal blood pressure, not the blood pressure they are experiencing during high anxiety situations. There are many ways to try to combat white coat hypertension, like rest before measurements are taken and taking multiple measurements, but the study we will be focusing on today is looking at the device used. We will be looking at the use of automated devices and the alternative method they provide for taking blood pressure measurements by removing the need for a healthcare professional to be in the room. This experiment was focused on different kinds of automated measurements. Specifically, they were comparing self-initiated and fully automated measurements. Self-initiated measurements required participants to start each individual measurement, while fully automated required participants to only start the machine once, and then it would work on a timer for recording multiple measurements. The reason for looking into this difference is because of an autocuff response that has been seen in those taking automated measurements. It is basically a form of white coat hypertension that occurs in automated measurements without the need for a healthcare professional to be present. The hypothesis is cuff response seen in self-initiated blood pressure measurements will be significantly lessened when using fully automated self-measurements. This table contains the results of the first experiment and includes comparisons between before, during, and after systolic and diastolic measurements for both self-initiated and fully automated. There is also heart rate and cardiac output comparisons, with cardiac output referring to the amount of blood pumped around the body within 1 minute. We see all highly significant differences in P1 and P2, with P1 referring to comparisons between before and during measurements, and P2 referring to comparisons between during and after. These are the significant differences for systolic and diastolic blood pressures. This means that in both types of measurements, there was an increase in blood pressure during the measurements. However, P star compares the during measurements for self-initiated and fully automated, with fully automated being significantly lower than self-initiated. This figure contains the results of the second experiment. Graph A is looking at systolic blood pressure, and graph B is looking at diastolic blood pressure. They both contain before, during, and after blood pressure measurements, but are only comparing between the self-initiated and fully automated groups for each measurement. For during, we see that there is a significant difference between self-initiated and fully automated for systolic and diastolic, with fully automated being significantly lower. For after, we see the same significance pattern, with fully automated being lower than self-initiated. So what does it all mean? The first experiment's results show that there was a significant increase in blood pressure for both self-initiated and fully automated, but significantly more of an increase in self-initiated. The second experiment's results showed that self-initiated caused higher blood pressure than fully automated, even in the manual after measurements. Therefore, these results support the hypothesis that white coat hypertension in the form of the autocuff response will be significantly lower in fully automated compared to self-initiated. If your blood pressure is consistently being misread as hypertensive, this could lead to a misdiagnosis of high blood pressure, which requires having high readings from multiple visits. If you are one that is prone to anxiety, especially when it comes to healthcare settings, having the proper methods be used for your blood pressure measurements is very important to prevent white coat syndrome from misdiagnosing you. The concern with misdiagnosis comes from the treatments that are used for high blood pressure, which include medications that drop your blood pressure by force. If you are given these medications when you don't need them, they can cause dizziness, headache, nausea, and even passing out. All of these side effects are potentially dangerous for patients. So next time you visit the doctor's office, stay calm, take a deep breath, and if you get a high reading, ask if they can check it again after a few minutes of rest. It's always better to be safe than sorry, especially when it comes to your health and avoiding misdiagnosis. Thank you and have a good day.